Hey everyone, and welcome back for another deep dive. Today we're taking a closer look at something I bet you've seen a million times but probably don't really understand. It's that perfusion index, or PI number, that you see on your pulse oximeter.
Yeah, most people are just looking at the oxygen level.
Right, like that's the main thing we think about with those little devices.
Exactly, but that PI number, it's giving you some extra intel that's actually pretty important.
Sure, and that's what we're going to break down today. We've got this awesome excerpt that explains exactly what the perfusion index is and why it matters.
Should we jump right in?
Let's do it. So the source starts off by defining the perfusion index. And basically, it's a measure of how strong your blood flow is at the exact spot where the sensor is clipped on your finger.
Right. So think about it like this. A strong pulse creates a nice, strong signal for the oximeter to read.
Okay, that makes sense.
But if the blood flow is weak for whatever reason, that signal is going to be weaker too.
And that's where the accuracy issue comes in, right?
Yeah, exactly. A weak signal can sometimes make the oxygen reading less reliable because the device is having a harder time getting a clear picture of what's going on.
I never realized how much those two readings were connected.
It's pretty fascinating when you think about it. I mean, we rely on these pulse oximeters for some pretty crucial information.
For sure. So let's dig a little deeper into the why here. The excerpt mentions that low perfusion can mess with the oxygen measurement.
Yeah.
But how does that actually work?
Okay, so pulse oximeters, they basically work by shining a light through your skin.
Oh, like those little red lights you see.
Exactly. And the device is measuring how much of that light gets absorbed by the hemoglobin in your red blood cells.
Hemoglobin, that's the stuff that carries oxygen,
You
right?
got it. Now, when you have good blood flow, that signal is nice and strong. It's like a clear highway for the light to travel through.
Okay, I'm following you.
But if the blood flow is sluggish, it's like trying to drive through a dense fog. The signal gets weaker and the oximeter has to work harder to get an accurate reading.
So it's all about the strength of the signal.
Exactly.
That makes a lot of sense. And you know what else the excerpt points out is that if you're seeing consistently low PI readings, it could be a sign to check in with your doctor.
Yeah, that's a really good point. I mean, one-off low reading, it might not be a big deal. Maybe your hands were just cold or something.
Or maybe the sensor wasn't on quite right.
Exactly. But if you're noticing a pattern of low readings over time, it could be a sign of something else going on.
Something that might need a doctor's attention.
Right. It could be a circulation issue or maybe something related to a medication you're taking. It's always best to err on the side of caution and get things checked out.
I totally agree. So let's say you're seeing those consistent low readings. What are some specific questions you could ask your doctor?
Well, you could definitely ask about potential underlying conditions that could be affecting your circulation, like peripheral artery disease or Raynaud's phenomenon.
Those sound pretty serious.
They can be, but it's always better to know what you're dealing with, right?
Absolutely. You could also talk to your doctor about any medications you're on that might be impacting blood flow.
And of course, if you're having other symptoms like coldness, numbness, tingling in your extremities, definitely bring those up too.
It's like putting all the pieces of the puzzle together.
Exactly.
Wow, who knew there was so much to learn about this little perfusion index number?
Right. It's like a hidden superpower on our pulse oximeter.
It really is.
Yeah.
So to wrap things up, what's the main takeaway you want listeners to remember about the perfusion index?
I'd say the biggest thing is don't just ignore that PI number. It's giving you valuable information about your circulation. And paying attention to it over time can really help you stay on top of your health.
I love that. And maybe even spark some interesting conversations with your doctor.
Exactly.
Well, that's a wrap on our deep dive into the perfusion index. We hope you learned something new today and maybe even feel a little more empowered to take control of your health.
Thanks for listening, everybody.
See you next time.